Tonight, the CDC has issued a health advisory across parts of the southern United States, warning of an increased chance of RSV. That's a respiratory virus that's spread through droplets in the air when somebody coughs or sneezes. It can be associated with severe disease in young kids and also older adults. In the U.S., RSV infections typically happen in the fall and winter. Last year, there were fewer cases because of COVID. But there is new concern tonight that we could see more RSV in the year to come. Joining us now is Dr. William Schaffner. He is professor of infectious diseases at Vanderbilt University School of Medicine. Sir, thank you for joining us tonight.
Good to be with you.
What concerns you the most about RSV?
Well, you know, now that we're going out and about and taking off our masks and gathering together, other respiratory viruses are showing up. And there are viruses other than COVID and influenza out there. One of them is RSV, respiratory syncytial virus. It is a virus that we can get numerous times during the course of our lifetimes. Infants can and young children can get bronchiolitis, have difficulty breathing, and older persons can have an influenza-like illness. It usually spreads in the fall and the winter, but since we're opening up now, this virus is taking the opportunity to go out there and spread, especially in the southeastern part of the country where I live, and we're tracking that now. So we're just advising people that stay away from people who are coughing and sneezing. And if you do develop symptoms, tell your doctor and get some testing.
Is there any particular reason why just the South is potentially going to see an increased risk in RSV? Why not in other parts of the country at this point?
We're not entirely sure. We're looking all over the country. Perhaps we're just starting first here in the Southeast. It's rather curious because it's the wrong season, if you will, for RSV. But nonetheless, we're alerting people, getting doctors when they see patients with these symptoms to test, to find out exactly what the illness is. And of course, we want to distinguish it from COVID.
We mentioned that the young and the elderly are most at risk. What are some of the symptoms to look for, and who is most susceptible in those categories?
Well, infants for sure. They can become lethargic, go off their feed, don't want to feed. They can have some fever and then develop breathing difficulties. Older persons present as though they were having influenza, aches and pains, sniffles, sore throat, sneezing, and then chest pain and cough.
And as I understand it from the CDC, the recommendation is if you have a child who is exhibiting some symptoms, to get them tested first for COVID to make sure it's not that, and then RSV? What's your recommendation?
Exactly, because of course we're continuing to be concerned about COVID. Now we have another viral player on the scene, RSV. We should test against that also if the patient is COVID negative.
I always hear when I take my kids to the doctor, it's a virus, go home, wait it out. Is RSV the same? How do you treat it?
Well, we treat it. You can give certain treatments to very young infants who are quite sick, but for the most part, it's symptomatic treatment and staying away from others so you don't catch it at home or elsewhere.
All good advice tonight. Dr. William Schaffner from the Vanderbilt University School of Medicine. I would imagine we're going to see a lot of colds and viruses pop up that we didn't see last year, but it's good we're prepared. Thanks for your time.